Welcome to The Treatment Plan, a podcast about how healthcare really works, from weight loss and patient care to the systems and incentives behind it all. Hosted by Jack Usher and David Usher, MD.
The main thing to talk about today is the obesity crisis and the medical weight loss aspect of what you do. And I think there's a large recognition of the fact that obesity is a problem in America. Everybody seems to know that. Everybody makes memes about it, jokes about how America's fat. But there doesn't seem to be quite the level of recognition, I think, just in the average Joe's mind about how that fact trickles into not only our healthcare system, but um, mental health, physical health, just kind of all the outgrowth, healthcare and otherwise, that comes from that. So maybe we can just talk a little bit about just your overview of kind of your philosophy, core values, really. We can get into the tactical stuff later in like a future episode of how you actually handle patients that come in, but this is going to be kind of more of a in big broad brushstrokes, how you think about what's going on in our current moment health wise, which is really dominated by obesity and people being overweight and metabolically unwell and stuff like that. And then for people who've never heard these statistics before, I pulled them up thanks to Perplexity Pro. Current obesity statistics in the United States: nearly 3 in 4 adults in the United States are now considered overweight or have obesity as of 2024, a sharp rise from just over 50% in the 1990s. Obesity prevalence among the US adults 20 and over was 41.9% between 2017 and March 2020. The rate of severe obesity in adults was 9.2% during the same time. And I believe severe obesity is measured by a BMI of
Body mass
greater
index over 40.
over 40. So
Mhm.
that's severe obesity. So that's 9.2% of adults in the United States. 1 in 5 US children and adolescents have obesity. That's 2 to 19. That's 20%. Southern US has the highest prevalence, with states like Mississippi and Texas leading. Notable disparities among racial groups: non-Hispanic, Black 50%, and Hispanic 45.6% adults have higher obesity rates compared to non-Hispanic whites, 41%, and Asian only 16% adults. And then the global statistics, I won't go through every single thing here, but 1 in 8 people worldwide were living with obesity. That's as of 2022, more than doubled since 1990 globally. Obesity is associated with numerous serious health conditions: type 2 diabetes, heart disease, high blood pressure, stroke, certain cancers, sleep apnea, fatty liver disease, gallstones, infertility, and about 50 more. The U.S. healthcare system, this is also a huge part of it: the economic and social costs. The U.S. healthcare system spends nearly $173 billion annually on obesity related costs. That's costs that you can directly attribute to obesity related issues, which I don't exactly know how they do that here, but people with obesity face annual medical costs $1,800 to $2,500 higher than those with recommended BMI. Obesity increases workplace costs, such as more sick days, high risk of short term disability, workers' compensation claims. Recruitment for, I mean, it just goes on and on and on.
It's endless.
Recruitment for armed services in the US is affected. This was a big news story.
Yeah, just
I think,
recently.
yeah, it's come up a couple times, but most recently it was like, yeah, here we go. 3 in 5 young adults. I was going to say, I thought it was like 70% or something, but 3 in 5 young adults are too overweight to qualify for military service. 3 in 5, that's 60%.
3 and 5. Oh, that's less than what I heard recently.
Yeah, that's also, I heard 70 or greater. And then the key takeaways, as according to Perplexity here: obesity rates are rising in the US and globally, with especially high rates projected for coming decades if action is not taken. The health and economic burdens are substantial, ranging from chronic diseases and higher mortality to large scale impacts on healthcare spending and social structures. That's basically covers about the social fabric and civilization in general. But maybe just get some of your reactions to those statistics, and then you can segue into what you think about how you view this particular issue, and maybe how you're a little different from what the mainstream view might be.
Well, those statistics they're mind-boggling, completely mind-boggling. As a family physician, you come through medical school and residency training and so forth, and you learn all about how do you manage diabetes and high blood pressure and these various things. At least this is dating myself, but this is 30 years ago, right? 1996, I graduated residency. At that time, everybody talked about, overweight as a contributor to these problems and maybe a cause, but nobody was presenting any kind of serious evidence-based solutions for how do you just resolve this. And now, 30 years later, I mean, you just presented numbers showing that basically obesity has just exploded. And there's, I think the latest statistic I heard from the Obesity Medicine Association was that we know of about 235 medical conditions that are either caused or contributed to by obesity. And among those are 13, very clearly 13, there's probably more, but very clearly 13 of what we would consider to be relatively common cancers that are the risk of which goes up because of obesity. And these are breast cancer and colon cancer and pancreatic cancer. These are not weird things. These are the common stuff. My guess is it's probably part of the reason that recently we adjusted down the screening age for colon cancer from 50 to 45 because the obesity epidemic is just driving more growth of precancerous polyps or neoplasms.
Yeah, and that's been reported on widely, even in the mainstream, Wall Street Journal, New York Times. Colon cancer especially is on the rise, and they say it's amongst young people, and they don't report in those stories whether people necessarily have pre-existing health conditions, or they have weight issues or obese or whatever. But the statistics would tell you that, I mean, likely they probably do, and that may have a direct or indirect impact on that.
It's epidemiology is a tough. I mean, it's an interesting thing, but it's sometimes people derive the wrong conclusions from associations. For a long time, people talked about red meat and cancer, and that has been looked at over and over, and that really is not clear that red meat has anything to do with colon cancer.
Yeah, and not only just on that point, not only are you having to do statistical reasoning, which is hard on that particular issue, but that's also a nutritional study or nutritional observational question, which is also just by its very nature, almost impossible to really draw a causative conclusion about.
No, that's exactly right. And of course, I look at it and go, well, what was the carb content of everybody's diet? And you just can't, there's no way to do that. Right. Having said that, so obesity is exploding, and you look at yourself and this is despite the fact that Americans largely over the years have kind of followed government guidance on what to do. You eat a low-fat diet, and maybe you exercise, maybe you don't, but the food pyramid back in whenever that came out in the early 80s, I think, and they just exploded the American diet with starch and sugar, basically, and so if you look at all of these pieces in context, like, okay, what's changed over the years? And you got to go way back 50 years, right? Because this is still evolving. We don't know where the end is going to be, how high these obesity rates can get. When I look at it, right, there to me is, and now I have, frankly, 20 years of experience gathering evidence that what I'm saying is true. But when I look at it and just go, what the big social things, it's not that we're eating more red meat, and it's not that we're eating more saturated fat or more fatty foods. That hasn't changed. So when people said eat a low-fat diet, what they did was just increase their concentration of the amount of carbohydrates they eat, and the percentage of fat in their diet goes down. So adding 300 calories a day of sugar or starch is going to lead to an obesity epidemic. And so there's a ton of reasons why that all occurs or continues to occur.
So that's really your primary thesis your kind of primary operating principle when it comes to not only weight loss, but just the obesity crisis, as they call it in general, which is our globally, but for sure in the United States, the obesity crisis is driven by an excess consumption of carbohydrate.
That's a mic drop statement. We're all done. All done here. We'll see you in the next podcast. If you take nothing else away from what I'm saying today, that is simply it. And so there's so much to say on this topic, but yeah. So if you look back, what changed? Okay, so just if you look at it from a governmental policy standpoint, who influences those policies, and who puts that stuff together, and how does that get pushed out to medical students and dietitian programs, and it all comes back to following money, right? Who's financing what, and then who's financing them, right? Who's in charge of that, and who's making money on healthcare when people are sick, and who makes money in healthcare when people are well, and we've got it's just so ripe for, I don't even want to call it corruption. I think everybody's just doing what they think is the right thing, except that they're at some of the highest levels. Talk about misinformation or disinformation. I think there's been a disinformation campaign for 60, 70 years around carbohydrate and sugar and so forth. And I think we're just now starting to scratch the surface on it. But yeah, that's basically it. It comes down to so many of these diseases that are contributed to or caused by obesity. Really, obesity is a disease process in itself that doesn't necessarily cause all these other things. It is a symptom of the same dietary toxicity that all these 230 other diseases are. People will say, I mean, you can talk about, there's a few things that obesity really causes, right? Having the actual physical mass of, let's say you weigh 300 pounds and you're 5'6". Just that physical fat mass will create things like acid reflux or obstructive sleep apnea or some skin fold problems, knee pain, hip pain, back pain. But what's really, aside from sleep apnea and the skin thing, when we bring people into our medical weight loss program and basically put them on a no sugar, no starch diet, all the protein you want, you don't overeat it. People don't overeat it when it comes to protein. They don't have to lose much weight before their acid reflux goes away and their joint pain goes away. Take somebody who's 300 pounds and put them on this diet, and the first month they maybe lose 12 or 15 pounds just by eating differently. And they'll come in and say, yeah, my knees feel a ton better and my acid reflux is gone and so on. And you look at them physically and they aren't much different to look at. And again, they've lost, 10%, 5%, small percentage of their total body weight, but they feel better after a week, and they'll come in and say, wow, what the heck happened? It's not like they lost a ton of weight and that's why they all feel better. I think it's that carbohydrate it's inflammatory. We know it is. And so these things that people think are related to the physical effects of obesity really are just effects of the food. And obesity is really just one more of those 235 diagnoses. It's associated with or caused by obesity. People like to say that, but I would say it's caused by the diet that causes obesity. Because obesity to me is just a side effect or a symptom that everybody can see of that carb toxic diet, American diet. Now we're spreading it worldwide.
When you say excess consumption of carbohydrate, a lot of what people hear is they would challenge you on that. People who are familiar with this, or at least somewhat familiar with this problem, because they would say, well, that may be true, and that's obvious in the cases of you're eating too much, you're eating too many sour gummies, or you're eating too many cookies, um, which many people probably are. But then they have an issue where they say, well, surely not all carbohydrates are created equal. And, well, my
Hmm.
broccoli has carbohydrate in it, and my sweet potato has carbohydrate in it. And are we not going to distinguish between that and your sour gummies and your cookies? And how do you think about that? We can, and if there's any delineation between a healthy person eating that sort of stuff, but the sweet potatoes and the broccoli, because I don't think anyone's going to make the case that the gummies and the cookies are good for you. Um, but between a healthy person and then somebody who might be overweight and thinking about just how do you view that?
People like to talk about complex carbohydrate, simple carbohydrate, vegetables, fruits, um, grains, whole grains,
White rice
brown rice,
versus
white
brown rice,
rice. Right.
sweet potatoes
There's a.
versus white potatoes.
I start with this when I have patients in the office, and they have what I think is a diet-driven complaint, which is a lot of them, and they don't know, and that's okay. But I start with this. And this is in my primary care population, not necessarily my medical weight loss population. The folks who come to us for medical weight loss, they've kind of figured out that they got to do something different. The people in the office with the complaint of let's irritable bowel syndrome, for example, diarrhea, bloaty, maybe nauseated, a lot of gas, um, maybe mixed in days where they feel constipated, but overall functioning okay, and they're not having blood in the stool, just IBS, irritable bowel syndrome. I will basically lay out for them that, look, there's a big long medical process you could go through. We could send you for a colonoscopy, do a bunch of blood work, all this stuff, and maybe we will do that CAT scan. But you're obviously not losing the battle. You're not losing weight. You're not running fevers. You're not having blood in the stool. Nothing abnormal on your physical exam. So what I think you have is irritable bowel syndrome. But let me tell you what I think irritable bowel syndrome is most of the time. I think it's carb toxic gut. Some people will call it leaky gut. There might be other names for it. And I would suggest that you do what I call, and I say this to them directly, I call it Dr. Usher's 2-week carnivore challenge. What does that mean? Well, what I'd like you to do is cut out anything that comes from a plant. Everybody likes to talk about plant-based diet. I'm saying I want you to do the opposite of that. I want you to cut out anything from a plant. Why? Because plants grow to be toxic. They don't want to be eaten. They have leaves, everything. They're bitter. Think of any plant that you eat that you don't do something to season it. I'm talking about plants as opposed to fruits, right? So asparagus is a plant. An apple is a fruit. And so, but a fruit comes from a plant, but we're going to get rid of all that plant-based stuff. All right, why? Because you don't need it. What do you mean I don't need it? Don't I have to have all those micronutrients and all that stuff? The answer is no, not if you're eating protein-based diet. If you're eating eggs and meat and fish and seafood and chicken and turkey, you'll get all the vitamins and micronutrients you could possibly need. But here's the crux to your point. To your body, all carbohydrate, in fact, is exactly the same. By the time you digest starchy sweet potato or white potato and break down the starch, which is just basically strings of glucose run together, and absorb that into your bloodstream and convert it to something that your body can use, that is a carbohydrate. Or if you do a fruit, same thing, an apple, grape, banana, broccoli, asparagus, whatever it is. By the time your body digests all of that stuff, takes the absorbable carbohydrate, which is basically sugar or starch, brings it into the bloodstream and creates something it can use, the only biologically active carbohydrate in the human system from an energy standpoint or a metabolic standpoint is glucose. Blood sugar, glucose. Not fructose, not sucrose, not starch, not lactose, not maltose, all these things that can come in, not high fructose corn syrup, all of those things become one thing in your bloodstream, and that's glucose. And so you ask yourself, well, okay, don't we need glucose? And the answer is glucose is absolutely critical to survival. People will talk about essential fatty acids that you got to have in your diet, or essential amino acids. The bodybuilders like to talk about that, this branched chain amino acids and these things you need to build structures and so forth. And that's absolutely true. The reason they call them essential is because it's essential that you eat them, because if you don't eat them, you'll become malnourished. Carbohydrate is essential to human functioning, but it's so essential that the body creates its own. So unlike fatty acids and amino acids, where it's essential that you eat them, glucose, but in just a small number of tissues, in the brain, the eye, and the kidney, there are very tiny amounts of tissues in the body that actually have to have glucose and are 100% obligated to run on glucose. And so those tissues have a guaranteed source of that, and that's called the liver. It's gluconeogenesis. What does that mean? You're making your own sugar, actually from amino acids. Happens all the time, happens especially at night. So the body can make all its glucose it wants, and every other that it needs. And every other source of carbohydrate, therefore, is giving you more glucose than you need. Why? Because your body already makes all it needs. So why eat all those carbohydrates and absorb all that glucose when you don't need it? The answer is you really don't need to. Go ahead. Sounds like you have a question there. This is what I tell people. I say, look, you just had your fasting blood sugar done and it wasn't normal. It was 104 or 105, or maybe it was diabetic, 150, but 70 to 100 is considered the normal range, but it's a graduated scale, right? So lower is better to a certain point. But the bottom line is, even if you don't eat for a week, your liver will keep your fasting blood sugar from going low because it's just continuously producing sugar for you. And that's how people starve, of course, is your liver keeps cranking this stuff out. But to do that, it's got to break down amino acids. And eventually you start stealing amino acids from the protein in your muscles and other skin and other places that your body aren't as critical as your brain, your kidney, and your eye. So it'll keep making glucose for you in order to keep that system stable, but it'll cannibalize the rest of itself to make those things work. So your fasting blood sugar it's not even low. It's not even normal. It's kind of high. How is it that they haven't eaten anything in 12 hours, right? They came in for a fasting blood test and your blood sugar is still high. And the answer is because your liver makes it for you, right? And it always has, and it always will. It's not compatible with life, really, for the liver to not make sugar for you. That would just be, you'd be a goner. So it's so essential that your body has carbohydrate, but the only carbohydrate that's active in the entire system that works is glucose, right? So if you look at all of these dietary recommendations that we've been dealt over the years, like for just thinking low-fat diet, right? 30% fat, 15% protein, and 55% carbohydrate. That's the low-fat diet recommendation from way back. And that's per calories, 55% of your calories, right? They talk about calories, energy. Calories, a unit of energy. So 55% of your calories are coming in a form of energy that your body can't even use. What do you think that's going to get us? And that's like, you're just going to storehouse all this crap. So the body takes all this carbohydrate in. This is basic. I mean, this is as basic as I can get it. I'm not an endocrinologist. I just talk in terms of how I can help my patients. But basic sugar metabolism 101, you eat something, if it makes your blood sugar go up, the healthy person will make a little bit of insulin from the pancreas, which brings your blood sugar down to normal. That phenomenon in itself just speaks volumes. But if you don't eat carbohydrate, your blood sugar doesn't go up in response to food the way it does when you eat carbohydrate. I mean, it might go up a tiny bit from protein or something, but not, it doesn't spike, right? Blood sugar, if you eat an ice cream cone, your blood sugar will spike. I mean, just straight up, and you're left with, and your body makes this insulin and brings your blood sugar back down. Very nice. But what's happened with you go to a low-fat diet, and what are you talking about? You're eating 55% of your calories in the form of something your system doesn't even need. It's unessential carbohydrate. There is no essential carbohydrate in the diet in the same way that there is essential fatty acids and essential amino acids. You could go completely carbohydrate free and be perfectly healthy. So any carbohydrate you eat only poses risk to you over time, right? And the more you eat, the worse it gets. So what happens over time is on this 55% carbohydrate diet, well, every time you eat something, you're eating this big load of carbs, your insulin goes up, your blood sugar comes down. And here, the rub is this. When your body's already got all the carbohydrate it needs, it has to put that carbohydrate somewhere in a form of energy that it can use later, because it doesn't waste the energy. Your body's very, very conservative. Survival 100,000 years ago, when we were still Homo sapiens sapiens, absolutely relied on our ability to store energy because we didn't have a convenience store or a grocery store to go to. We just had to find the food when we can find it. Mostly that was hunting, scavenging, little bit of gathering. But so the body has to conserve energy. It's very conservative. So if you eat a bunch of carbohydrate, it will take that. Your insulin goes up. But what your insulin does is turns on the enzymes that allow your fatty tissue to create fat from sugar, your blood sugar, glucose. And it turns off the enzymes that would allow you to burn that fat for energy, because you're in this, they used to call it a fed state. Well, what it is, a fed state, when I was in medical school, they talked about the fed state versus the fasting state. And the fed state basically means that you ate carbohydrate because you need your insulin to go up to keep your blood sugars from becoming toxically high. So imagine that you're doing that over 50 years and you keep subsidizing all the social phenomena. This is so deep and rich and complex. It's fun to talk about, but it sounds like I'm rambling. Imagine, back in the 70s, the 80s, when we started subsidizing ethanol production for gas tanks. Put that in your gasoline, and all of a sudden, you're producing these huge, huge, huge amounts of ethanol, mostly from corn, which is 90% of the field corn market in the United States goes to ethanol production. I'm going to take that back. Some sort of corporate use. People aren't eating field corn. We're not feeding that much to animals, but some huge percentage, right? And the spinoff of ethanol production is high fructose corn syrup. So you get this kind of almost a free byproduct for the ethanol producers, and then they can turn around and sell that. And there was an explosion in the variety of everything you can think of, candy, soda pop, all these junk foods, about the same time, because all of a sudden now sugar was really cheap. You could use fructose instead of cane sugar and put this in all these things. And now all of a sudden you got this really cheap crap food going out everywhere. And the federal government, in its infinite wisdom, was for the longest time, you could be on food stamps and you could buy this crap food with your food stamps. I mean, talk about a setup to keep the poor people poor. Let's just make them poor and sick. And this was known back then by very smart people. That's why I say follow money. In any case, what happens is over time, your insulin goes up and down and up and down and up and down in response to the carbs in your diet. Eventually, your body just says, hey, whoa, we don't have the capability to keep up with this. And your body becomes somewhat insulin resistant. It no longer hears the insulin message. And then over time, your fasting blood sugar creeps up and creeps up because you just can't get crank out enough insulin anymore from your pancreas to bring your blood sugar down to a normal level. By the time people get diabetic, they've already been sick from carbohydrates for 10 years or more. What we call pre-diabetic. So diabetes is really I mean, that's really way down the road of metabolic disease. By the time somebody's measuring diabetic, that's why they're so high risk for heart disease and so forth. In any case, so if you look at, so you do the 2-week, Dr. Usher's 2-week carnivore challenge. It could be any doctor's 2-week carnivore challenge. Why would I call it somebody else's? Just don't eat any plants for 2 weeks. And they come back in and universally they're better. Like, what? Are you kidding me? Yep, I know. Right. So then you have to kind of go through this whole discussion, right? About plants are basically, they've been sold to us. We eat them, but there's nothing natural about that in the sense that, you go to the grocery store, all you're getting is hybridized fruit, things that are been crossbred and crossbred and crossbred to have more fancy colors and more sugar content. So they're yummy. And then sure, give me an option to eat 5 fruits and vegetables. I'm going to eat 5 fruits before I'll eat 5 vegetables because that's what the government told me to do. And people have responded to those government recommendations over time. And yet we're still getting sicker and sicker.
So there's a couple of things that have come up just in your explanation that came to mind. One is what I'm hearing you say is really this is a food-driven crisis.
Oh, 100%.
Yeah, so that's one leg of the stool.
Mm-hmm.
Is there's because there's theories about is it environment? Is it this? Is it that?
Mm-hmm. Mm-hmm.
But you're saying that this is a discussion about food and diet.
I would say anything other than this discussion about the carb toxic diet is nipping at the edges,
Yeah.
which every organization over time, it seems that every organization wants to do this. They don't really want to solve the problem. Political parties, government organizations, big healthcare, big medicine. Who's going to make money on people who aren't sick, right? I mean,
the other thing that what I was noticing in your explanations is there's a divide between the individual circumstance and the individual's physiology, how what they eat, that person eats, affects them, and how they can address that, or how we can take care of them. Then there's also the population level guidelines, and it feels like those are two separate discussions almost. Like there's the
give me an example.
well, like it's a food-driven crisis. Food is a very cultural thing. Cultural changes can be influenced by policy, but a lot of people would argue, and I feel this also, that cultural roots are far deeper than what a government may not recommend in a particular policy agenda or what they subsidize or tax or not.
Yeah, culture will eat your strategy for lunch.
Yeah, exactly. So that's what I mean by individual versus population at one level. But then the other thing related to that is people will say, well, that may be true, what you're saying at the individual level, but then you look at population level statistics, especially in other countries that don't do this sort of diet that you're recommending,
Mm-hmm.
and they have staples in their diet that are clearly carbohydrate, but be it bread or pasta or potatoes,
Right.
whatever you want to call it. And they are doing just fine, or they're doing a lot better than
They're doing better so far.
better. Why is that? That doesn't seem to make the case to me to completely eliminate carbohydrates, or that carbohydrates are a toxic product or a toxic thing to consume for people, full stop. How do you respond to that?
Well, I would say that there's, currently Robert Kennedy Jr. is banging the ultra processed food drum, and I think he's onto something. I think if you look at the quality of what goes into foods in other places, I always like to think about Italy. Everybody tells me how good the pasta is in Italy, and they went over there and ate nothing but pasta for 2 weeks and didn't gain a pound. If you could drill down on that, I'm theorizing because I don't do a lot of study into this, but just the quality of the flour and how they process it and how they treat it. And the fact that there's behavioral differences, we have a car-based culture here, right? So there's a lot of things you could say about that, confounders, if you will. But if you also look at, I think I've seen or heard people report that the rate at which other countries adopt U.S. style eating patterns is directly proportional to the rate at which their obesity rates are going up. Right. So back to the RFK ultra processed food things, I think he's on to something here. I don't think it gets, as far as I'm concerned, to the deepest level. But I think it's certainly going in the right direction and getting the conversation started, which is great.
Well, speaking of ultra,
it doesn't change in the least the basic fact that you can go 100% carbohydrate free and be perfectly healthy. And that lie of you have to eat carbohydrates continues to be promulgated everywhere. And by not saying that first and leading people to think that, oh, I have to eat, I hear it all the time. Oh, I eat oatmeal and I eat yogurt and I eat this and I eat that. Things that are just loaded with carbohydrates, and they've been told that these are healthy for them. And there's no evidence for any of that. It's food industry. Who put together the USDA guidelines? It's like a committee of 150 food industry representatives. Where's the science?
Let's go into that a little bit, because there's a school of thought, like you said, where it's just carbohydrates are completely unnecessary. You don't need them to survive. They're completely physiologically unnecessary, and we don't need them at all. And people should, therefore,
who don't need to eat them.
Who don't need to eat them, and therefore we shouldn't consume them. That reads to me sometimes like, why use toilet paper when I can wipe my butt with my hand? Like, we don't need toilet paper to have a clean butt, but it sure is nice.
I need toilet paper.
Well, but my point is, you don't need a toothbrush to be healthy, but boy, you sure helps. That's where I think there's a bit of a disconnect in this debate when you hear about it, when people are talking about it on podcasts and they're writing articles about it, and there's the public health debate about it. There's a disconnect there, because people have an intuition, or they have their own experience where they are maybe really physically active and they're athletes. The greatest athletes in the world are not on low carb diets,
and they're also not obese.
They're right.
Although there are people who run ultra marathons who have great times and they don't eat carbs.
That's true. That's also true.
And while they're running 52 miles, they don't have to drink Gatorade or take glucose tabs, because they're burning their fat instead of their sugar.
That's true. But a vast majority of ultramarathoners do eat carbs. The best in the world do eat carbs.
Yes, but you're talking about a 0.001 something. Some ultra minute level. And to point to those people, you could also point to, those. It's like talking about, the certain people on the planet, live in 30,000 square foot mansions. Yes, some do, but most of us don't.
I only point that out to say that the line of argument can galvanize some people, or it's very polarizing sometimes when I hear that, because the line, without any real nuance of carbs are unhealthy, is completely lost on people. Because if it's unhealthy, why would people whose livelihoods depend on their performance or their health, why would they be eating something like that?
Right. Oh, so my answer to that would be, it's basically, you're entitled to your own opinion, but you don't get your own facts. And if we can't get this basic fact straight, the conversation will never change, because all those people who can't accept this fact will continue to conflate the problem, right? And the basic fact is, your body makes all the carbohydrate you will ever need, period. Eating carbohydrate, while yummy, while enjoyable, while done by ultra marathoners and athletes everywhere, that doesn't change the fact that the only thing eating carbohydrate can do for you is make you sicker, not healthier, right? And so you can have conversations about how much carbohydrate to eat. And if you are, an ultra lean athlete and you're out burning 5, 6, 8, 10,000 calories a day, think Michael Phelps, or other marathon runners, whatever you want to do, swimmers, those people may enjoy eating all those carbohydrates. And because they're so ultra fit and their insulin sensitivity is so high and they're literally burning all that energy every single day because somebody's paying them to do it, those people don't fall into what I would say at a population level is what a population needs to hear. The population needs to hear that any carbohydrate you eat can only risk making you unwell. So go ahead and have, you can talk grams, but 10 grams, 20 grams, 50 grams, 100 grams, 300 grams a day. But you need 0, right? If you can start with that basic fact, and that's a fact, that's not disputable. If you can start with that and say, okay, how much can I tolerate? And so when we get people who've lost, 100 pounds of all their excess body fat, or as much as they want to lose, they'll start saying, okay, they've been doing basically 20 grams or less of carbohydrate per day. Not 0, but less than 20. And people will lose weight tremendously on that small amount. The average American eats, I think, 250 or 300 grams of carbs per day. I mean, just ridiculous amounts. So you get them down to tiny amounts, which is a couple of vegetables a day. I mean, it's not like we're completely depriving people of things, but if they're not losing weight fast enough, I tell them just cut the veggies. You don't need them. It's just to make your diet more interesting if you want it. So when they get to that place where they say, okay, now I don't want to lose any more weight, how do I just want to maintain my weight. How do I do that? Well, all you have to do is find, reasonable carbohydrate rich foods or foods with some carb, just to increase your carb count slightly. That might be add an apple a day, because in the average apple, there's like 20 grams of carbs. How many grams of carbs? A teaspoon of white sugar is 4 grams of carbohydrate, right? So when you say, gee, I eat this apple, how many? That's like eating 5 teaspoons of white sugar. And to your body, that's exactly what it is. The body will just convert it all to glucose. And so it doesn't matter what that apple looks like or how sweet or how yummy or how many little micronutrients and vitamins, whatever. Your body doesn't need those from a plant. It gets it all from meat sources or eggs. But it does take those 20 grams of carbohydrate, converts it to blood sugar. And blood sugar stimulates insulin. Insulin stimulates fat. Voila, you stop losing weight and you maintain.
We've had obviously many versions of this discussion and many versions of this discussion before. But what the mental image that is coming to mind just from us talking about it in this way this time, is that you can almost, I'm trying to think, okay, what carbohydrates, I would almost describe them the way you've kind of summed it up. I would almost describe them as like a performance enhancing drug.
That's exactly what it is.
Yeah.
Yeah. And
It's a PED.
Maybe it improves your performance.
Well, I think we can draw a reasonable conclusion that if the best athletes in the world who are paid, who compete at the highest levels, if not consuming carbohydrates was the way to go, they would be doing that. And they all consume carbohydrates at the highest levels. Yeah, endurance athletes, strength athletes. And some of them don't, like you said, but a vast majority of them do. So if we just take that as a given fact.
But if you carve those people out, right? Let's talk about normal humanity and what culture would be without professional athletes. You take the money away from those people, they wouldn't perform at those levels because nobody's paying them to do it. So let's just think of human survival, thriving, healthy human culture without those really extreme athletes.
No, I'm not disputing that carbohydrates don't necessarily have a place in with normal people. But it's giving what I'm trying to accomplish is giving people a realistic mental model. It almost it can feel like a gaslight when you're like carbohydrates are like horrible, nobody should ever eat them, because then it's like, well, why can't we have a conversation about why anybody
You're
eats them?
creating what I would say is a straw man here. I'm not saying don't ever eat them or that nobody should eat them. What I would say is,
But they
let's
must
be
have
honest,
some sort of positive benefit.
they don't. Period.
So so you think that they even, because I'm taking the athlete
Um,
example
Now, if you
because
take
they
the extreme athletes, yeah, they glycogen load. They need, if they're going to do like powerlifting,
yeah.
that um, you want to have enough glycogen stored in your muscles
Okay, so that's a
to be
benefit.
able to crank out that 1 extra pound or
Yeah.
whatever that is, right?
Yeah, at the limit. Yeah.
Um, and those glycogen stores will be replenished without eating carbohydrate if you allow your system to. But yeah, that's the whole thing of carb loading and so on and so forth. Um, if you look at powerlifters, they tend to be kind of fat,
Well, that's true too.
generally. Um,
Yeah, and well,
but
there's also a physics element
yeah,
with
that's right.
powerlifters
And
too.
they're
Yeah, yeah.
the extra, whatever that is, center of gravity, all that stuff, right? Yeah, look at professional football players. But you also have to look at their energy balance overall, right? I mean, they're if you could take the opposite tact and say we need the entire society, instead of cutting out carbs, we need everybody to become marathon runners. That's how we'll get healthy.
The reason I was pushing so much on this question because it does feel just like such a radical idea, because it strikes so many people kind of where it hurts with how much of their diet consists of carbohydrates, of fruits, of bread and pasta and potatoes and the things they see on their breakfast tables and kitchen tables and stuff like that. But the question I think that I'm getting at, and maybe you can just respond to in this way, is how what why do people who rely on their performance and their fitness in a particular category, why do they consume carbohydrates? And why does that not apply to you, the listener?
If you could take the average person and somehow get them performing at that level, then they could eat carbohydrates also. Um, yeah, insulin sensitivity and the amount of energy they use moving themselves about in space, basically, right? Whether it's fast twitch muscles or running or long-term aerobic kind of things. These people don't get to be extreme athletes or high performance athletes overnight. They've done this for years and years. And the people who struggle with their weight didn't become overweight overnight. They've been working out for years and years, eating what people told them to eat or eating what they can afford. Eating what maybe a dietitian or a nutritionist told them, what the federal government told them, and the dietary guidelines. And if they were, the problem is by the time people get to the point where their weight is at least problematic enough to come in and see me for weight loss, their entire life is built around this weight problem, right? They don't feel like moving. The typical advice that doctors would give us, oh, eat less and move more. Well, these people just don't feel like moving more. It's hard to breathe because of the physical presence of fat inside the abdomen as well as fat on the abdomen, fat on the chest. If they have sleep apnea, they don't have much energy. They continue to eat because they get a fast hit of energy during the day. So having a Coke or a Mountain Dew or something with some energy and some sugar, keeps them going for the next couple of hours. And it just contributes to the problem. It just self-perpetuates. So if you could somehow magically reset these people and say, okay, here's the deal. We'll take 200 pounds or 100 pounds of fat off of you, but you need to start running in order to not regain the weight. I mean, which sounds more ridiculous? Let's just cut back on the carbohydrate rich foods or just start running, or start swimming extreme distances. It's a much simpler thing when you just lay the facts out. And the fact is, your body makes all the carbohydrate you need, and carbohydrate can only make you sick. So you can eat a lot, or you can eat a little, or you can eat none at all. But the less of it you eat, the higher the chances that you get healthy or get healthier or reduce your risk of bad things. And so that's what I would say to people. I think there's a basic fact that if everybody just acknowledged this, then the rest of the conversation goes fine, right? And the basic fact is you don't need to eat carbohydrate to survive. You can, in fact, be very healthy if you don't. If you start there, that doesn't mean that you shouldn't ever eat carbohydrate, that nobody should, or that there can't be people out there who eat tons of it. But that doesn't change the fact that you could go completely, and I say carb free, that's basically a carnivore diet because there's no carbs in meat and there's no carbs in eggs, or lard or butter, very little, if any, in sour cream. I mean, all these things. Well, that's really high in fat. Yeah, but fat doesn't make you fat. Carbohydrate makes you fat.
That was a really good response, and that helped me understand. And there's so much we could go into there, which is like satiation and fat versus, there's the fiber debate. There's exercise. We didn't even talk about exercise. I mean, we talked about athletes, but we didn't talk about just kind of exercise in general. So there's so much more to get into. But I totally agree with what you're saying with that. I was kind of flip flopping on like extreme athletes versus the average overweight person.
Right.
And like I said, I was doing that to
Right,
kind of
right.
paint a picture of how people think about carbohydrates kind of in a vacuum or in a general nutritional sense, but especially in your clinical practice and what people far more often experience or what their lives kind of revolve around is the fact that if you're overweight or you're obese, you are in fact ill, you're sick, and you're in need of intervention and treatment. And just like if you had, you know, the flu or
Right.
something, you wouldn't be. There's all these things you don't do when you have the flu, and bed rest and fluids and there's there's things you don't do. That's at least how I kind of imagine it with obesity. Is there's this protocol, and there's all these things you can do, and all these things you don't do, and you need to do those things or avoid those things to get better before you can go on your merry way and do other things.
Right. You can have people who are avid runners and they have type 2 diabetes because their diet is so carb toxic. Like, how come I have to treat myself for diabetes and I do all this running? So, well, what are you eating? And that's, then they tell you about their diet. You go, well, there's your answer. I mean, you're eating, it's food additive. That's the best way I've seen it. You can talk about it. People talk about fat, protein, and carbohydrate as the macronutrients. Well, carbohydrate's not a nutrient at all. It provides absolutely no benefit to eat it. Can you burn it for energy? Yes, you can. Can it do things? Yes, yes, it can. But nourishing to me provides essential stuff that is healthy for you and makes you healthier. And carbohydrate does not make you healthier. And it's an addictive drug. It works on the same system in your brain as drugs. That's why we get all jazzed up about eating certain foods. I call it the yay factor. People go, ooh, yay, cheesecake or whatever, blueberry pie, corn, sweet corn, whatever those things are. So it has a million detrimental effects, but it is a food additive. It's addicting. It's certainly psychoactive. It's inflammatory. You can look at IL-6 and cytokines of various kinds. Just all the toxic effects it has on the body, and there's no justification for encouraging people to eat carbohydrate, other than if this is what I need to be this elite athlete that I really want to be. Okay, because that works for you. But even elite athletes can drop dead of heart attacks, right?
Yeah, you see that not a heart attack, but just in general, you there's a trope of I work out all this, I do all these things, and therefore my diet is like I have a get a jail free card for my diet. I can eat anything I want because I just work out so much.
Right. That's like saying I can smoke as many cigarettes as I want because I run. I mean, it is. It's that crazy.
Yeah. When you
Like,
put it that way,
really,
it just
that
seems
logic
ridiculous.
is just, it's lost on me. Like, but that gets back to that. If the society really wanted to do itself a favor, it would just put on every billboard in every city, okay, you don't need to eat anything that comes from a plant, period. It'd be a political revolution. There'd be all these people out there chanting in the streets, but they're all environmentalists and wackos, and they're not looking at the facts. You can't have your own facts. The fact is, if you ate zero carbohydrate, you'd only be healthier. It can only make you sick. It can't make you healthier. And if you want to test the theory, I would encourage you to grow, harvest, and eat your own plant food, and you don't get to season it, and you don't get to cook it. Just eat it raw, and then see how that goes. People just won't do it. The plants are bitter and they're yucky tasting, many of them, until you do something to them, and but they don't occur in nature in the way that we do. We're growing broccoli in massive fields, and they've been hybridized to look like it looks like. And cauliflower, same thing. You try to find that stuff in nature, it doesn't exist. And you would never be able to survive on it because there's not enough energy in it. That's the thing about, it's low calorie. Yeah, so why are you eating it? You're wasting your time eating something that gives you no energy and no amino acid, very little amino acid, and no fatty acids. So what's it giving you? Well, carbohydrates and micronutrients. Can I get those micronutrients somewhere else that also gives me essential fatty acids and essential amino acids? Yes, that's called eating animals. Fish, seafood, chickens, turkey, pigs, cows, bison, deer, whatever. You pick your animal.
Well, there you have it. There's so much more to talk about. There's the dairy in between of dairy. What is dairy? There's exercise. There's satiation that we talked about, or we touched on a little bit. There's just your clinical practice, how people fare, what they struggle with. There's so much more to go into on this topic, but we'll leave it there and leave it for next time. This was a great pod.
Thanks for listening to The Treatment Plan. If you enjoyed the conversation, subscribe on YouTube, follow on Spotify or Apple Podcasts, and turn on notifications so you never miss an episode. And if someone comes to mind who'd like this show, tell them about it or send it their way using the share button.